Okay, we've got a scary modern Western medicine disease here we're dealing with here. Now, I'm Chris Volesky with TCM Hub, and this is Script Assist. It's a tool that we use with other practitioners where they will write in case studies and they will ask us how to treat and work through the case study. So in this particular case, we've got a case of fibromyalgia with early stage kidney disease. Now, from a Chinese medicine standpoint, these things are completely irrelevant and completely meaningless because in Chinese medicine, we look at patterns and how these patterns present with an individual patient. So we're looking at symptoms, we're looking at things like pulse and tongue, other objective signs that point us in the direction of how we would treat this particular case presentation. So I'm going to go over this stuff, but as it stands right now, fibromyalgia and chronic kidney disease are completely meaningless. So I'm going to take all this information they've given me and I'm going to eliminate all the extraneous detail and I'm going to just put down what is actually relevant. So we've got this patient with fibromyalgia, again, meaningless. The joints are sore, so we know we've got some pain. Where there's pain, there's stagnation in Chinese medicine, so we at least know that. It's especially in the knees, and the muscles and limbs feel achy and heavy. Okay, now we've got a sign that we can work with. Heavy and achy muscles is for sure a sign of dampness in Chinese medicine. So we already are starting to understand that there is some disease mechanism at play and some idea of how we might start addressing that. But then there's also a lot of cramping and spasms in the legs. Now, most often from a Chinese medicine standpoint, this is actually what we call blood deficiency. And it could relate to a nutrient deficiency, it could relate to an actual anemia. However, we've also got this presence of dampness, which is a fluid metabolism issue. It could pertain to swelling, it could pertain to extracellular fluid, it could contain to lymphatic congestion. And when we see these two types of concepts together, it is entirely possible that there is this thing occurring, which is called dampness blocking the blood. So actually this fluid metabolism issue is what is leading to this issue of poor blood nutrient circulation delivery into these muscles, which is perpetuating this problem of spasms and cramps. So I've got these ideas in my head now of how to start looking at this. So let's keep going here. Constantly blowing her nose, and there is a lot of yellow mucus. So again, mucus in and of itself is a damp sign. The fact that it's yellow points us in the direction of heat. It means that there's a retained pathogen in there. So we know that there's some kind of pathogenic issue going on. This appears to be a very chronic problem, recurrent bouts of sinusitis, and even an operation on the sinus cavity. Okay, now knowing this, that there have been these recurrent bouts of this sickness, that tells me that there is retained pathogens, that there is likely a biofilm issue. Again, this pertains to dampness, but this idea of retained pathogens would get into the concept of what we call the Xiao yang in Chinese medicine. It means that there is something that got in the body and it is stuck in there. In this case, there's a pathogen that's not leaving the body. Now, you can treat this kind of thing with antibiotics and it works very, very well, but they will not break down the biofilm. And this biofilm will hide the pathogens in there. And those pathogens will wait until a moment where your immune system is down, when you're stressed, you're tired, where your body cannot fight well. And especially when there's not antibiotics in your system, they'll come out of this biofilm and they'll create another infection. I see this time and time again with conditions like fibromyalgia, some autoimmune diseases. There's this issue of recurrent infection, oftentimes recurrent sinus infection, and this biofilm issue has to be dealt with in there. Another chief complaint would be tiredness, fatigue. From a Chinese medicine standpoint, anything can cause fatigue. If there's dampness, it's going to cause fatigue. Fatigue almost always relates to something we'd call spleen qi deficiency, so we know that there's a degree of that in there. And when we look at the age of this patient, it's a 34-year-old female. We know that at that age, stress is going to be a component of lifestyle, that they're moderner, so their modern diet is going to be a piece of there. So we know from a Chinese medicine standpoint that the liver and the spleen are going to be intermixed in this. And most often with modern peoples, the liver and spleen are sort of the heart of the whole issue. And then these other issues like damp, blood stasis, heat are actually a further manifestation of this core disharmony. So oftentimes I'm thinking we have to be addressing this core disharmony, and then we use other herbs that are going to address these other pathological manifestations that are causing, the joint soreness, the tiredness, and whatnot. So less tiredness. We've got blood work that's showing the GFR 73, that's too low. There's low creatine. The kidneys are not filtering optimally. They're in early stage kidney disease. Again, this is totally meaningless from a Chinese medicine standpoint, but I'm going to tell you how I'm going to address that anyways. Likely related to some medication that she was on when she was younger. Recurrent cystitis infection, recurrent bladder infections. So again, this is a pathogenic problem, probably some biofilms at play here because it's a recurrent issue. And most often this is pertaining to dampness and heat retained in the body. So again, we're seeing this recurrent idea of damp, recurrent idea of retained pathogens in the body. We're seeing this over and over again. We're seeing some blood stasis in the tongue. I'm going to pull the tongue in here in a minute. She's also tends to be very thirsty and constantly wanting cold drinks. Now, from a Chinese medicine standpoint, when we're looking at things like thirst, when a person is very thirsty, it's going to mean that the pattern itself is showing predominant heat signs, which can pertain to inflammation. It can pertain to some type of pathogen in the body as well. Actually, in this little intake form, it also shows that sometimes she'll be thirsty without a desire to drink. Now, this is a fluid metabolism issue. And what will tend to happen is when there's this greater predominance of a fluid metabolism issue, there might be thirst, but you just don't really want to drink because you're already burdened with too much fluid in the body. But then as the inflammatory process takes over, you'll start to get very, very thirsty. Your body will heat up, your body temperature will heat up, which is what these pathogens will do. Pathogens that are creating this yellow mucus. And then you'll sort of oscillate back and forth between these things. It's like sometimes you don't want to drink, other times you can't get enough to drink. And looking at this intake form here, this is just a collection of sort of more random symptoms that just pertain to different organ systems. One of the things that I'm finding here is there's this frequent nighttime urination. Again, this is a damp retention in the body. Now, some of these signs might look like a weakness in the body, and most often with modern peoples, it's not really so much a weakness. And people like to load themselves up on these adaptogenic herbs, thinking they're going to strengthen their body, make everything better. But more often than not, we just need to get rid of the extraneous stuff the body is carrying. This might mean excessive fluid accumulation. It could mean dealing with pathogens. It could mean improving circulation. More often than not, improving these things will provide much greater benefits to health than trying to load up on some kind of adaptogenic herb. Because more often than not, it's that your body's actually burdened by what it's carrying rather than being too weak. It's like carrying a backpack full of rocks uphill and saying, I need an energy drink because I'm tired. No, take the rocks out of your backpack and you're going to be fine. You don't need the energy drink. Okay? So just taking a look at this, let's peek a little bit at the tongue photos. It's kind of purple. We do have a slightly thicker coating here, which would pertain to this dampness. When the body of the tongue here is a bit darker like this, it's going to pertain to more stagnation, maybe poor blood flow, poor circulation. We see this a lot with fibromyalgia anyways, because people feel ill for so long, they stop exercising. And these sublingual veins are very distended, again, pointing at this circulation type issue. Now, she is proposing utilizing some herbs, Xiao, which is for the gut-brain stress axis. Very great formula, appropriate for this case, but not right now, not at this stage of the game, because we know there's retained pathogens. She's suggesting something called Tang for the dampness, along with Tang for the blood stasis. Again, this is a great combination. I use it all the time. Totally inappropriate in this particular stage of how things are working, because they're not going to treat the pathogens at all. And if you're not fixing what's going on with the immune system, you're going to end up with progress, and then you're going to have a quote flare up, and you're going to end up right back at ground zero because everything's going to go back to the way it was. You have to address that immune system first. And then she's also asking about a formula called Jingui Shenchuan. This is again, adaptogenic type formula. It's a kidney tonic. And I think the idea here is that we're going to improve kidney function. This is an erroneous way of thinking about it. You can't just make this false equivalent that a kidney tonic from a Chinese medicine standpoint is going to treat kidney disease from a Western medicine standpoint. We still have to look at these patterns and address those patterns. Otherwise, you're going to be taking this and you're either going to make the patient worse, it's going to be too hard on their digestion, which in other ways will make the patient worse, or it's just simply not going to work at all. And then you're doing a disservice to your patient anyways. When we look at this, I'm seeing a lot of these signs of damp, a lot of these signs of retained pathogens. The first formula I would consider here would be Sanwentong. This one we know gets rid of damp out of the body. It actually induces urination and bowels to provide a place for this excess fluid to get out of the body. It improves lymphatic flow. It's anti-inflammatory. We use it for things like cystitis. We use it for, mild infections as well, all this nasal mucus. So that would be my first choice. It's generally going to be very helpful for this muscle ache from all this damp there. And then I would consider a formula called Xiao Chai Hu Tong. First and foremost, it's going to aim at these retained pathogens in the body. It's broad spectrum antimicrobial. And it also has an effect to support host immunity. So you're attacking these pathogens, but you're also aiming at strengthening the body to be able to combat on its own. Also been found to help with these biofilms as well. Plus, it's a liver spleen harmonizing formula. And as I mentioned earlier, that is an important concept when it comes to Chinese medicine, that we have to be harmonizing this liver and spleen in most chronic conditions, because that's the toll of modern lifestyle, and we have to be addressing that. The other really kind of cool thing about that is that there is research on this formula combination and addressing early stage kidney disease. We use it all the time with our mold patients, with our fibromyalgia patients, with our autoimmune disease patients. And it's also been researched for animals with early stage kidney disease, this particular formula combination. So this is exactly what I would do with this particular patient. I would probably do this from anywhere from 2, 4, maybe 6 weeks. As those things calm down, then we can look at further addressing some of these other other things that we're seeing in there. But more than likely, this is going to hit the entire picture very, very well. And it's going to clean everything up to where we can start to dial in more specifically with certain issues.